This is pelvic cavity, pelvic bone, which is placed like this. This is in posterior part, and this is interior part, interior and posterior. It has three surfaces, four borders, three angles. First, we're gonna talk about surfaces. We have three surfaces. First surface is this gluteal surface, which is the largest, and it is concaved, and it is the largest surface which is concaved, and it is known as gluteal or external surface, and it is located on the posterior side. Then we have it is called gluteal surface because of a line present here known as this gluteal line, which is parallel to the lateral border. This is medial border, this is lateral border. This gluteal line is parallel, and it distally continues with the superior ischiatic line. Okay, and it gives attachment to superficial deep gluteus muscles and middle deep gluteus muscles. And here we have a foramen here somewhere. Here we have foramen. This is foramen, is known as Newton foramen, present on the lower part of the gluteal line, and this is for gluteal surface. And we have other two surfaces. This is the iliac surface, and this is the pelvic surface. First, we're gonna talk about iliac surface. This is the iliac surface, and it is smooth and it is convex, and it presents a crest on its upper border, that is on its dorsal border, known as iliac crest, which separates it from the gluteal surface and the iliac surface. And then it is smooth. After that, the lower part of it forms a fossa known as supracortical fossa, which gives attachment to the rectus femoris muscles, and here iliacus muscles is attached. Then we have this pelvic surface, which is attached, which is towards the pelvic inlet. That's why we got it pelvic surface, and it is attached to the wings of sacrum, and it is towards the pelvic inlet, and articular facet for sacrum. This is it for it is also known as sacral surface. We have three angles. First is external angle or tuber coxae. Second is internal angle or tuber sacrale, where sacral is attached. This is the internal angle, this is the external angle. And third, we have this cotyloid angle, which is having a cotyloid cavity. We are done with surfaces, angles. Now we're gonna on four borders: dorsal, medial, lateral, and pubic. First we have medial border, posterior or ischiatic border, which is at the posterior or the medial side of the ischium, and it forms, and then after that it forms a spine known as superior ischiatic spine, with which the sacroischiatic ligament is attached with the and sacroischiatic ligament of this is attached with the sacrum and forms the greater sciatic foramen and lesser sciatic foramen. Here greater and here lesser. ठीक है, उसके बाद आ गया हमारे पास have four borders. First we're gonna start with the medial posterior or ischiatic border, and it is located on the medial or posterior side, and it is continuous after its lower part. It forms superior ischiatic spine, and to it the posterior border, the sacroischiatic ligament is formed, which forms the greater sciatic foramen and the lower sciatic foramen here. And then we have this medial border. Then we have this lateral border or cotyloid border. It separates the gluteal and the iliac surface, and it is continuous with the cotyloid. The fourth border known as dorsal border, which is rough and irregular, and it presents a crest known as iliac crest, which separates the iliac surface and the gluteal surface from each other, and it's enough. This is the fourth border that is known as pubic border, iliopectineal line, and it is continuous with the posterior border. Here you can see, okay. It begins below this triangular area. It continues with that triangular area. It separates the pelvic and iliac surface to form each other, and here is a small tubercle present here like this, known as psoas tubercle, which gives attachment to the psoas major and minor muscles. Yeah, this is it for